Is this a videotape or a broadcast?
It's a live broadcast.
So basically,
So we are up now and we're live. We're just waiting for our viewers to join.
So we'll do this.
talk to them.
So we're gonna put this mask on, it's gonna force.
We'll allow a few more viewers to join the broadcast, and we will explain exactly what you are about to see.
So I guess they're explaining.
We are at the SIM Center, or the SIM Lab. It's in the basement of St. Louis Fire Department EMS headquarters. I have with me paramedic supervisor Rich Parks. Brother Parks, can you explain exactly what the SIM Center is and what we will see here momentarily?
Okay, the SIM Center is our training center that we're using to hone in on our skills and sharpen our skills to better provide care for our patients in the city. Kind of helps the paramedics, but in the outcome it helps the EMTs, and it also helps the citizens. Our overall objective is to provide excellent care. So what you're about to see, we have one crew that is here. We're practicing some training so that we can provide these skills and kind of pass them along to our firefighters, EMTs, and paramedics that are out here treating the folks of the city. Right now they're going over airway assessment and airway management of an asthma patient, which right now, in this time of the year, it's really one of the things we see a lot of. We see a lot of asthmatic patients, some of them in extremis, some of them not so bad. But this patient you're about to have witness to us doing our training on is a little bit more in extremis. And so we're going to just kind of give you an insight of what our training entails, and we'll go from there.
All right, let's take a look. So this is an asthmatic patient that we're about to see?
Correct.
Okay.
So in here, as we proceed in this room, what you folks will witness here is we have obviously a mannequin that we use for training. We can't really train on real people to teach. This patient is a patient who is an asthmatic and extremis. If I'm real quiet here for a minute, hopefully you can pick up. This mannequin provided by the Life Saving Foundation for the fire department is actually lung sounds that we can hear. You can actually hear those. I'm standing here in the room, can hear them. And like I said, if I'm a little quieter, you might be able to pick up on that.
So it's actually breathing. That sound that we hear is simulated breathing of the actual mannequin?
That is correct. And so, hold on here, let's see if you can pick up on that.
Okay.
And so, who we have here in the room with us today, we have Paramedic Crew Chief Michael Beckenholt on your left, Paramedic Crew Chief Rich Parks on your right, and standing off here in the background, running part of our simulator is Captain Guy Jennings. And so what they're doing here is they'll do an assessment. This mannequin actually gives real vital signs, if you will. You actually can obtain a blood pressure on this patient. You can actually hear lung sounds. You can actually see the chest rise and fall, all the things that we would see in a real patient. So as the patient gets better or worse, one of the things that can change, and that's what Captain Jennings is doing here, is he can actually make those vital signs and things that they would assess change to where they would show whether their treatments are actually enhancing the patient's care and making the patient better, or in some cases where no matter what we do, the patient does not get better until we actually transport them to a hospital.
So we get immediate response based on how the members treat the patient. If they're doing something wrong, then the patient's vitals, or basically how it responds, will decrease. It'll
well, if
worse.
they're not as much as they're doing something wrong, but if they need to do something different, if they need to enhance their treatment, or sometimes we'll start off with a lesser aggressive therapy and see how the patient responds. If the patient doesn't respond to something that is a little bit less invasive, then we may have to go on to more invasive medications or procedures before we can get them stabilized and hopefully get them stabilized and then get them to a more advanced care like the hospital, which is our goal, is to help them here and then to be enhanced when we get to the hospital.
Okay. What's that contraption on its attached to its head and affixed to its face there?
That is a CPAP, and it also has, in this case, what we would use is a medication updraft. A lot of times, most of your asthmatics are familiar with that as an albuterol updraft, or there's other drugs that we can administer through that. when patients get into an extreme inabilities to breathe on their own, they start getting tired. This is a positive pressure ventilator that kind of forces a little bit of air into the lungs. It kind of enhances their breathing. So they may be tired or maybe unable to provide enough air into their own lungs. This thing is a positive pressure, so it kind of forces a little bit of that air in there to help them out.
Okay.
Has really good outcomes. It's really been a benefit to our patients and their overall outcomes.
Well, this patient looks to be breathing pretty well, so I'm thinking that we did good work here.
They are doing a good job.
Okay. All right. Thank you, gentlemen, for allowing us to take a peek in. Brother Park, let's go ahead and step outside and see what other stations we've got going on in the other room.
Follow me.
Thank you, guys.
As we proceed out here, this is a little bit more of a different training area. We have different things going on.
Okay.
These are our trainers, and we're kind of practicing here today to get things going. Some of the things you see here, like over here to my right, you have a patient that's on a cardiac monitor. We can simulate different cardiac rhythms and dysrhythmias so that our paramedics can experience some of the rhythm changes and things that they need to do in a simulator before they get out and actually treat a real patient that may have these cardiac dysrhythmias or cardiac changes.
Okay.
And so again, it kind of helps hone their skills and get them better prepared. This area over here, we're doing the same thing. We have paramedic Sean Daniel, paramedic crew chief Pfeiffer, paramedic James Arnold, and we're assessing a patient while having hooked up to a 12-lead cardiac monitor, where paramedic Arnold has a little device in his hand that he can change the cardiac rhythms depending on the scenario, scenario based.
All right, so this is really advanced equipment that we're training on, and everyone here is at least a paramedic. These are the individuals that will be training other EMS personnel and firefighters in the future?
Correct. Everybody in this room is a paramedic, and we will be training paramedics and EMTs. This is not strictly just a paramedic-based facility.
Okay.
We'll do paramedics, EMTs, and also the first responders will get to come down here and experience some of this stuff. And again, the rationale behind it, with the Life Saving Foundation helping to provide this equipment, it definitely will enhance what our abilities to do in the field and get people better prepared. Because some of these situations that we run across, you may not see a particular cardiac rhythm. You know, some people may not see it in their whole career.
Right.
So the one time they see it, if it's on a live patient, it's a little bit more, you know, you got to pull out the cobwebs and kind of get things going. At least if we can experience those things here in a simulated lab, they'll be better prepared to take care of the patient when they see it for real.
All right.
So that's our goal here.
All right, Brother Parks, well, thank you very much. Great training, practice here so that when we get out on the street, you know, we are ready to go. And thank you, a special thanks to the Life Saving Foundation and all the donors that are helping this project come along. Still a work in progress, but we will get there.
It's a great benefit. Thank you.
And thank you.